welcome our live studio audience this morning, lifting families together to help kids get through various health challenges. So thank you all for being here. It is Medical Monday, and we're starting off with our panel of doctors in medical hot topics, including new findings on those painful kidney stones, how a popular soda might affect men's fertility, and what to know as we begin this year's flu season. Joining us this morning, family and cosmetic dentist Dr. Terri Alani, internal medicine physician Dr. Kristyn Greifer, and urologist Dr. Kenworthy. Good morning. Good morning. Flu season officially starts. I think still a lot of people underestimate how deadly the flu can be. At times, kind of the #1 killer around the world, right?
Last year we had 80,000 deaths.
Wow.
That's more than car accidents. It's a more important thing for us to address than most people think.
Yeah.
And it's easily preventable with a flu shot.
Yeah. However, with that said, we know that the flu vaccine was not quite as effective last year as they thought it would be. So how does that process work and then trying to figure out what's going to work for each season?
I know last year was only 20% effective. And I'm in the dental industry, and I got a flu shot. And
because your hands are in people's mouths all the time.
Yeah.
You're this close to people all the time.
But this year, supposedly, they've come up with a new vaccine. Am I correct? Yes.
Every year they look back at the year before and they see what the prevalent flu strains were, and they readjust.
Yeah.
And sometimes we get it right, and sometimes we don't get it right. But even when the flu vaccine is less than effective, 20%, 40%, that's a 20% or 40% decrease in your risk of getting the flu. And if you get a flu shot and you do get the flu, the likelihood is that you will have a lesser severe flu.
Yeah. Okay, there's these myths out there, like I've heard people say, well, I think if you get the flu, there's a little bit of live virus in there, and if you get the vaccine's going to give you the flu. It's not live, is it?
It will not give you the flu.
Yeah.
So the thing
not
is,
a live vaccine.
There is one live vaccine, and that's the Flu Mist. It's the one you put up your nose.
Okay.
It's not recommended for people who have compromised, like
HIV, things like that, yeah.
or on cancer drugs or whatever. But other than that, you cannot get the flu from the flu vaccine.
Yeah, yeah.
So if you're older and if you're compromised, then you really need to get the flu shot no matter what.
Two populations,
Yes.
younger people, kids, right, and older folks who generally can't weather the storm quite as well as some folks right there in the middle. And then there's different methods of how, like,
and
if
let
you
me
need
say
2
just
doses.
one other thing. I'm a dentist. If you have the flu, if you are sick, please don't come see us.
Cancel your appointment.
We have patients that come in to see us, and they don't realize how susceptible we are.
Yeah.
So just stay home.
Well, that's how
don't
it spreads,
spread the
right?
virus.
Yeah,
Yes.
And the earlier the better, really, because it does take a couple of weeks to become effective. So
today.
Today.
So I have a question, Tamiflu.
Yes, yes. Because, well, we were told that if you got the flu in the first, like, 70-something hours, if you could get a hold of Tamiflu, that it could help you heal faster.
Tamiflu in the first 48 hours will significantly reduce the length of time that you're sick and somewhat the severity of your symptoms. It's worth getting if you're older and have higher risk for significant complications. So the really young, the old, pregnant women actually are the other group that need to get the flu shot. The flu in pregnancy is an incredibly dangerous thing.
Okay.
Tamiflu can technically prevent the flu for people who are at high risk, who are exposed. That's something you really need to talk to your doctor about.
Let me tell you, okay, so there's this one too. Okay, I hear this a lot, and I'm one of those people. I've never gotten the flu.
Well, listen, just wait. I got the flu 5 years ago. I had the flu. I was out for almost 14 days. So you don't even need to take that chance, because when you get it, it's horrific.
Well, it can be, and it also can be the different strain, right? It can be that one that gets you, and also I think when you get older, your immune system changes, things change, and so you can never say 100% that you're not going to get it, even if you've never had it. All right, there's a new study that overturns what we know about kidney stones. For the longest, people would say they don't dissolve on their own, they cannot dissolve. Apparently, you're saying that they can dissolve, but do you want to wait for it?
Well, it was a very interesting study, and it looked at the specimens from surgical specimens, so looking at the stones under a very complex and microscope, up to 1/1000th of a meter. So looking at the crystalline structure, and what they found was that there's layers within the stone, which we've known, but showing that it may go through a process of dissolving and recrystallizing and dissolving and recrystallizing. So although it is true that we cannot physically dissolve one in the person's body if it's made of calcium primarily.
Yeah.
It opens the opportunity for more research and study into that process we may be able to affect dissolving calcified stones
I
with
have a friend
new
with
technology.
kidney stones, and we argue back and forth about what's most painful. He goes, trust me, it's the most painful. I'm saying, no, my brain aneurysm was more painful. He goes, no, kidney stones are more painful. We're back and forth arguing about that.
Does drinking lemonade help prevent kidney stones?
The citrate in the lemon juice is an inhibitor of crystal formation. So yes, it can be
Real
beneficial.
lemonade.
Real lemonade.
Yeah.
Real lemonade,
From
yeah.
lemonade to Mountain Dew. This is one of those things that can be kind of dangerous because I think sometimes people hear this and think, oh, okay, does Mountain Dew kill sperm? And so that gets put out there, and I could see some teenager right now going, I'll just drink this and we're all good.
No.
Yeah. No.
The simple answer is no.
They're going, what? Right? But you remember when you were a teenager, some of the stuff that you would learn from other kids, right? And it would go around because your parents weren't going to tell you anything about sex until you were 30. Yeah. So
But
yeah.
I'll tell you what will happen. If you drink enough Mountain Dew, you're not going to have any teeth because you have so many cavities. You won't have to worry about sperm count because you won't have a relationship.
Yeah, there you go. Unless you go get your teeth redone with Dr. Terri Alani. All right, yeah, but it's a long-standing myth. They said because of the high level of caffeine or the yellow dye, number 5. But the evidence of negative effects is not enough to be conclusive. So don't think you can just drink some Mountain Dew and get busy. Don't do that. Okay. Healthy yogurt might be like a sugar bomb. We get so tricked into these things that say, oh, it's healthy, it's healthy. And so, as we know, on the market you can have yogurt, but what kind of yogurt? This is where you have to pay attention to what you're reading in terms of what's really in there.
It's common sense. So you have to look at the protein. I eat a lot of yogurt, and I'm very health conscious. So you look at the protein content, and usually high protein is going to keep you from, it's going to suppress your appetite, right?
Okay,
Keeps you from getting hungry. So also look at the sugar content. So there's some yogurts where the sugar content is much lower and they have a high protein. There's some yogurts that have a low protein content and very high sugar content. You want to stay away from those. And then you have the Fage yogurt, which you actually have the yogurt, and then you have the
fruit
on the
mix
side.
with it, yeah.
So just mix a little bit, and you'll not have so much sugar.
Yeah, and are you mixing real fruit or are you mixing some
Exactly,
jam stuff,
yeah.
right?
It's important to look at the labels because often when you reduce the fat content of food, you replace the taste of fat by putting more sugar in.
Right.
And so just because it says 0% fat doesn't mean that it's as healthy as it looks.
Yeah, because fat doesn't make fat, but the sugar and carbs will make fat. All right, so you said, okay, they're trying to trick us. From trickery to trick-or-treating, okay? Yeah, so I'm making connections here. You like that one?
I do.
Okay. How many of you went trick-or-treating as kids? Right?
yeah.
Oh, yeah.
Yes.
And you got home, and in fact, I would pick out all the great stuff before I got to the house. So when my mom rationed my candy, I wouldn't care because I'm like, I didn't like that stuff anyway, right? But every time if kids are going to go trick-or-treating, they're going to be eating half of it on the way as they're doing that.
Exactly.
And they get home, it's late at night, and they go straight to bed. That stuff is in their mouth, and they have like a candy fest for like the next month, right?
Yes. So as far as for tips for trick-or-treaters, first of all, if you're going to pass out candy, and I say do it, don't ration it, chocolate. Chocolate's the best because it actually melts in your mouth. So your saliva
Not
is
in your
going to,
hands.
yes, melts in your mouth, not in your hands. The worst would be anything sticky or really chewy. That's going to pull the sealants out of your child's teeth, so you want to stay away from that. And also anything that's real sour, because that sour is very acidic and it can actually harm the enamel on your teeth. The other thing is, if you're going to have your child do the trick-or-treating, sit with them afterwards, pick out the candies, use the other for a gingerbread house or whatever, and then have them eat the candy right after the meal, and just make sure they brush their teeth. Now, one little tip, if they have sour candy, you want to wait 30 minutes till they brush your teeth, because if they do it within the 30 minutes, that acid can actually harm the enamel. So you wait 30 minutes.
Okay.
So you want that saliva to neutralize the acid.
So you eat your Sour Patch Kid, and let's
Yes.
set the timer right now.
Yes.
All right, and then brush for at least 2 minutes, right? All right.
And then don't do the Mountain Dew.
Don't do the Mountain Dew with
At the
that
same
because
Don't eat it all.
and then don't think you can eat a yogurt on top of the Mountain Dew with your Halloween candy because everything's going to just
And
fall
then some
apart.
hot Cheetos.
All right, thank you all very much.